Dr. Rachel Pearl, who is a physician and a pediatric nephrologist at William Osler Health System. So we'll be discussing about kidney issues in kids. ਅਸੀਂ ਅੱਜ ਪ੍ਰੋਗਰਾਮ 'ਚ ਗੱਲ ਕਰਾਂਗੇ ਬੱਚਿਆਂ ਦੇ ਅੰਦਰ ਜਿਹੜੇ ਕਿਡਨੀ ਦੇ ਇਸ਼ੂ ਹੈ ਉਹ ਕੀ ਹੈ, ਕਿੱਦਾਂ ਪ੍ਰੀਵੈਂਟ ਕਰ ਸਕਦੇ ਕਿ ਨਹੀਂ ਕਰ ਸਕਦੇ। ਸੋ ਡਾਕਟਰ ਪਰਲ ਸਾਡੇ ਨਾਲ ਹੈ ਵਿਲੀਅਮ ਔਸਲਰ ਹੈਲਥ ਸਿਸਟਮ ਤੋਂ, ਜਿਨ੍ਹਾਂ ਦਾ ਆਪਣਾ ਇੱਕ ਕਲੀਨਿਕ ਹੈ ਆਊਟਸਾਈਡ ਦਾ ਸਿਕ ਕਿਡਸ ਹਸਪੀਟਲ। Dr. Rachel, welcome to the show.
Thank you.
If you can introduce yourself to our viewers, please.
Sure. So I'm Rachel Pearl, and I'm a pediatric nephrologist at William Osler. I'm also a general pediatrician there, and I run our pediatric nephrology clinic, which is out of Peel Memorial Center.
So Dr. Pearl, what is pediatric nephrologist? Because many people, they don't know this word. If you can explain.
So pediatric nephrology is about the medical care for children with kidney problems. I'm a medical doctor. I'm not a surgeon, so I don't do any operations. And I look after children all the way from 0 until 18 with kidney problems. I also sometimes see pregnant mummies where there's something about the baby's kidneys and they're going to need some counseling to prepare for the baby's birth.
So to understand better, you don't see the seniors with kidney issues, you see the kids with the kidney issues.
Right, I don't see anyone over the age of 18. That's correct, yes.
So Dr. Pearl, if you can tell us about the campaign, which is Doctors Making a Difference, and this is the 5th series. So what is that campaign?
So the campaign is highlighting doctors out of William Osler that are making a difference in the community, and I was very grateful to be chosen. And the patients that I chose are a wonderful set of twins that I follow in my nephrology clinic, and they're now 7, and I've seen them since they were babies.
So Dr. Pearl, you have a clinic, kidney clinic outside the Sick Kid Hospital, and this is one of the few dedicated clinics for the kidneys. If you can tell us about that clinic.
Sure. So our clinic started 20 years ago. At the time when we started, there was no outpatient clinics in Brampton, and also there was only about 200,000 people in Brampton, and now there's more than 600,000 people on our census, and we are the only kidney clinic outside of the hospital for sick children that serves all of this Peel region. We see patients from Brampton, Mississauga, Georgetown, Milton, Oakville, and then north as well. And so we're seeing children that are referred because there's a problem with their kidneys. The problems that children have are different than in adults. So in adults, a lot of people have diabetes or they have high blood pressure and they develop a kidney problem from that. But in children, often it's something about how their kidneys were made when they were born, that it was built differently. And so we can see this now when the babies are inside mummy, and then the babies are born, and we follow them through in our clinic until they're 18. And sometimes it's not a serious problem or a big deal, and sometimes there is something that could be very serious for the patient, and they may end up needing transplant or dialysis. But that's not very common. Most of the kids are healthy kids who are going to school that come and see me in the clinic. We also see children that have high blood pressure. We see children with kidney stones, blood and protein in their urine, and we see children like these twins that have different electrolyte problems with their sodium or potassium.
So where is this clinic?
So the clinic is at Peel Memorial Center, which is at 20 Lynch Street, and there's actually quite a large pediatric clinic there. We have lots of different subspecialists. We have pediatric gastroenterology, which is a GI specialist, a stomach and bowel doctor. We have a doctor that sees children with asthma and other breathing problems, neurology, actually almost every subspecialty that you can think of, we have there.
So Dr. Pearl, you treated twins, Mani's daughters.
Yes.
So can you share their story, like they were born with the kidney issues and now how they are doing now at present?
Sure. So these girls, they were actually born prematurely at 32 weeks. And I met them when they were in our neonatal intensive care unit at Brampton Civic. And we realized on day 1, actually after their first day of blood work, when their potassiums were high, like really high, that something was not right. And we transferred them to the hospital for sick children. And they were there for 2 months or more. And then they came back to us in Brampton, and I've been looking after them in my clinic. So the girl's condition is very difficult to manage. You have to be very, very careful with these kids. If they cannot eat or drink or they start to vomit, they have to come to hospital and get treated and admitted. And so the children need lots of extra sodium. and they need a very special diet so that they don't take in too much potassium. Their condition is actually very rare. It's not a very common problem. And their mother has been amazing at looking after these girls and making sure that they come to all of their appointments, that they get their medicines, and they need it a few times a day, the medicines. And they have lots of doctor's visits, and it's also been hard because both of the girls have hearing loss. When they were small, they had bone fractures, which is actually nothing to do with this kidney problem, but was another problem. And so their mom has been fantastic at looking after them. The girls will always need extra sodium. And as they get older, hopefully they will learn to take it by mouth. But for now, it's really yucky and salty, as you can imagine, tastes terrible. So they have a special tube that goes into their tummy that will give them the medicine directly. And even if they're sick or they don't want to take it, their mom can give it to them and make sure that they get their medicine.
So is it true that these kids, the twin kids, one of them, she cannot hear, the other has different issues?
Right, so both of them have trouble with their hearing. So one of them had a cochlear implant, and the other twin has hearing loss and has a hearing aid. And they're at a special school that's helping them with their talking. And before, when they first used to come to see us, every time they would have a blood test and they would cry and cry when they would see me. But now, as they're getting older and now they're learning how to speak, I'm hearing their voices for the first time, like hearing what they have to say, because they're old enough, they're not as scared as they used to be because they're now 7. And because of all the therapy and the speech therapy and everything that they've had, they're able to talk to me. And that is so rewarding to see them, like being like normal kids. They're small, but they are small kids. They're smaller than a normal 7-year-old, but they're learning and developing, and I can't wait to see what they do, how they are as they get older. And that's such a privilege. As a doctor that looks after these kids, I can watch them as they get older, and by the time they're 18, what are they going to be doing? Where are they going to be? It's going to be very exciting to see.
It's always said that doctors always saves lives, and you are one of the biggest example. Like because we read the Money's View, these twin daughters, their mother reviews, we read it, that she said no other doctor can do what you did for her.
Yeah, so, it's very kind of her to say that. But the truth is that she responds to what's happening with the girls, and that's the best thing that can keep them safe, and I can only advise her, but she's the one that has to do it.
So Dr. Paul, we are into Peel region, and the South Asian community is the dominant here in the region of Peel.
Yes.
What is the reason that they have more diabetic patient? The kidney issues are also dominant. Does the diabetes affect the kidneys also? So what is the reason South Asians have these issues?
So actually the reasons why children and adults have kidney issues are actually completely different. So while I do see some children with diabetes and with a kidney problem from their diabetes, most of the kids that I see that have a kidney problem who are South Asian, it's nothing to do with diabetes. But a lot of the kids have structural abnormalities like an obstruction or urine going back up, and they might get urine infections. So that's more common. And also a condition called nephrotic syndrome, which is where children start to leak protein in their urine. And that's actually much more common in South Asian patients. And so we have a very large group of patients with a condition called nephrotic syndrome because of it. And this was a very good place for me to set up a clinic because we have so many patients that really have a need. Like they really don't want to have to travel 2 hours down to the hospital for sick children for testing that we can do in Brampton. And actually, out of Peel Memorial, out of my clinic, we have ultrasound in the building. We can do blood work in my clinic, and I can get a result in an hour for a blood test for potassium or for a protein level or a kidney function test. We test the urine in our clinic. We have specialized nurses who know how to take blood pressures for children. And I have dietitian help. I have occupational therapy, and we have a social worker. So lots of other multidisciplinary support. I also have a wonderful nurse practitioner who works with our patients with nephrotic syndrome, and the patients can email and phone her when they have questions or have a problem, and then she can help decide if they need to be seen sooner or have a blood test.
So if someone has to reach you, they have to come through the Osler or their family doctor. How can they reach you for the kidney
so if
issues?
Patient has a kidney problem, their family doctor can refer them to us, or any doctor can refer them to us, and we'll see them with a referral. And we triage our referrals. So if I look at the referrals, and if it's something that is very serious, they will be seen very fast.
Okay.
If it's something that's not as serious, they might wait a little bit longer. The newborns are all seen very quickly. So any newborn where there's a potential kidney problem, we see them very quickly, and the same with pregnant mummies. We get them in before they have their babies so that we can counsel.
Okay, so kidney issues in kids and in the seniors, because after 50 we saw that many seniors, they started developing the kidney issues. The protein issues started there.
Right.
So is that a difference, or is the same issues?
No, so it's going to be very different. So adults have high blood pressure and diabetes most commonly as the cause of their kidney problems, whereas in children it's usually nothing that they that they did or didn't do. It's about how their kidneys developed, or how their what they were born with. And there isn't anything that they could do. We want our kids to have a healthy lifestyle. We want them to go to school and to learn, and that's their best chance to have a good job, have a good life, so that they can make money to support themselves as they get older. And we don't want kids to be worrying about their health, but that would be the best thing that they could do to stay healthy. I don't look after adults, but I know that kidney problems is not something you feel. When you have a kidney problem, if you don't go and see your doctor, you won't know. So you have to go and get checked out. Just because you feel good doesn't mean that there isn't something going on with your kidney. So if you have diabetes or high blood pressure, see your family doctor, get checked out, follow up with your specialist. That would be my advice.
Any final tip to the residents?
No, but just to know that if you have a kidney problem, that we will be able to help you, and if you need any more specialized help, we will be able to help arrange that as well. William Osler, we have wonderful support there for people with any type of kidney problem, and also other specialist problems. We can help with that.
Dr. Pearl, thank you very much for this vital information, which is very helpful for our viewers.
Thank you very much.
Thank you. ਸੋ ਅਸੀਂ ਕਿ ਡਾਕਟਰ ਰੈਚਲ ਪਰਲ ਜਿਨ੍ਹਾਂ ਨੇ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈ ਕਿ ਬੱਚਿਆਂ ਦੇ ਅੰਦਰ, ਕਿਡਸ ਦੇ ਅੰਦਰ ਜੋ ਕਿਡਨੀ ਦੇ ਇਸ਼ੂਜ਼ ਹੈ, ਉਹਨੂੰ ਕਿੱਦਾਂ ਕੀ ਉਹਦੇ 'ਚ ਇਫੈਕਟਸ ਹੈ, ਕੀ ਸਿੰਪਟਮਸ ਹੈ, ਔਰ ਉਹਨੂੰ ਕਿੱਦਾਂ ਐਡਰੈਸ ਕੀਤਾ ਜਾ ਸਕਦਾ ਹੈ, ਕਿਉਂਕਿ ਡਾਕਟਰ ਪਰਲ ਸੀਨੀਅਰਸ ਦੀ ਕਿਡਨੀ ਨਹੀਂ ਦੇਖਦੇ ਆ, ਬੱਚਿਆਂ ਦੀ ਜਾਂ ਪ੍ਰੈਗਨੈਂਟ ਵੂਮਨਸ ਦੀ ਕਿਡਨੀਜ਼ ਦੇ ਮਾਹਿਰ ਹੈ। ਇਹਨਾਂ ਦਾ ਆਪਣਾ ਕਲੀਨਿਕ ਹੈ ਆਊਟਸਾਈਡ ਦ ਸਿਕ ਕਿਡ ਹਸਪੀਟਲ, ਵਨ ਆਫ ਦ ਡੈਡੀਕੇਟਿਡ ਕਲੀਨਿਕ ਇਨ ਪੀਲ ਰੀਜਨ। ਸੋ ਤੁਹਾਡਾ ਵੀ ਕੁਐਸਚਨ ਹੋਇਆ, ਤੁਸੀਂ ਜ਼ਰੂਰ ਲਿਖ ਭੇਜੋ।